Pleasant good day to all. I hope you all are doing well despite the new pertinent challenges that we all are facing for substantive time. My name is Habiba Hassan Khan and I'm your co-host for this evening. It's my first and foremost pleasure on behalf of my team members to warmly welcome all of you to this insightful session. Thank you for joining the Live Study Group's first webinar for 2021 in live conversation with Dr. Samana Sayed and Dr. Nida Rizvi on COVID-19 rehabilitation. The Life Study Group is a team under the Students Against COVID movement. We are a collection of interested and enthusiastic students. We are a collection of interested and enthusiastic students willing to help others progress and enhance their knowledge amidst this global crisis. The Life Study Group consists of two sub-teams. Firstly, the General Life Study Group, where we promote education via various means like webinars, study flashcards, case discussions, and much more. And secondly, Mental Health and Student Support Team, where we provide a safe space for students to motivate and encourage others. Do feel free to be a part of SAC and by extension, the Life Study Group. More details will follow at the end. At this time, ladies and gentlemen, we are all aware of the rapid increment in COVID-19 cases globally, and this third wave has brought a lot of complexities in the world. So we decided to organize this webinar in order to educate people worldwide regarding COVID-19 rehabilitation. As we know that cardiopulmonary therapists are playing a crucial role in COVID-19, so this evening, I'm tasked yet privileged to be introducing our featured speakers, Dr. Samana Sayed and Nida Rizvi. They will be sharing their wealth of experience in COVID-19 rehabilitation. Excused, who's there? They will, so guys, as we know that the cardiopulmonary therapists are playing a crucial role in COVID-19, so this evening I am tasked yet privileged to be introducing our featured speakers, Dr. Samana and Nida Rizvi. They will be sharing their wealth of experience in COVID-19 rehabilitation. If you have any questions throughout the webinar, go ahead and pop them in the chat box.
Excuse me, you guys.
I will be responding to them in due time.
Excuse me.
Excused, who's this?
Actually, two people are speaking at the same time.
Excuse me. Hold on, let us check.
No, I guess it's fine. I think there's some problem in the other computer. It's fine, I guess.
Okay. Okay, you want me to continue now? Can you just hear me? Okay, so firstly, I'm privileged to invite our guest speaker, Dr. Samana Sayed. Dr. Samana has joined us all the way from India amidst this ongoing and very challenging situation. We are really grateful for having her on board with us tonight. Samana is a well-known cardiopulmonary therapist. She is famous worldwide because of her cardiopulmonary rehabilitation, COVID specialty, and as a spine rehabilitation therapist. She has conducted various researches and webinars worldwide. Tonight, Dr. Samana will be briefing us about COVID-19 prevention and post-COVID rehab. Without further ado, I now invite Dr. Samana to take the lead.
Hello, everyone. I hope I'm visible and audible.
Yes, you are.
Hi, everyone. Hello, everyone. I hope you all can hear me. Right? Shall I go ahead?
Yes, we can hear you. Go ahead.
Okay. So thank you for the introduction and thank you all of you for joining. I'm Dr. Samana Sayed from India and thank you for the lovely introduction that you have given. So I won't waste any more time on that. Today we are here for discussing about COVID-19, that is something which we all know. I think we take the name of COVID-19 more frequently than we take our family members' name nowadays. So it's very important for us as a physiotherapist, students or professionals, whoever are working, to know exactly what our role is in this pandemic as a physiotherapist. So I think, Habiba, shall we go ahead with the discussion or like so that I can explain more in detail about whatever you all want me to talk about?
Yes, definitely. Samana, so my first question to you is that you have given various workshops regarding COVID inpatient rehabilitation. Can you please let us know the role that a cardiopulmonary therapist plays in post-COVID-19 rehabilitation?
Okay. So when we talk about cardiopulmonary physiotherapy, or let us just concise and call it as chest physiotherapy, it will be easier for us to actually talk then. When we talk about chest physiotherapy is all about dealing with your lungs, your cardiac system, anything that affects your heart, your lungs, etc., etc. So when we talk about COVID-19 virus or COVID-19 disease, we all know by now, because it's been more than a year now, that it primarily affects your respiratory system, and it has got more affinity towards your respiratory receptors. ACE receptors to be more precise. So basically, the thing is that when this infection affects your lung, it aggravates, or you can say the symptoms gets aggravated in various stages. So before going to post-COVID rehabilitation, I would just brief a bit about it, so that, when we go ahead with the discussion, you understand what I'm exactly trying to explain you all. So basically, when it invades your lungs, if the disease is mild, and if there is just minimum invasion to your lungs and all, usually it starts producing various, you can say, peripheral invasion, peripheral changes, or the slight minor changes in your lungs. And if you treat it at that time, or if your immunity is really strong to fight the virus, the disease usually starts subsiding, or the symptoms start subsiding. If not, then the disease progresses and it leads to other infective conditions like viral pneumonia. And if the disease further goes ahead, like if the progression further goes ahead and the patient's body is just not able to fight with the virus in very much layman language, or the immunity is not enough, or if the patient has got a lot of comorbidities, then the patient can go into respiratory distress, or you can say ARDS. Now, if you will see in all these stages, of course, the lungs are getting involved. But as a physiotherapist, now if you will try to look at it from my point of view, if suppose the patient's lung is minimally involved, still there will be some patches of ground glass opacities. That means there will be some areas in the lungs where the airways will be affected. Now, if the patient is going into pneumonia, again, the consolidatory patches will be there, where we have to work on later when the patient's COVID is resolved. Or if the patient is going into respiratory distress, then as we all know, and we must have, you all must have read about it, that as the respiratory distress or ARDS recovers, it leads to various fibrotic patches inside the lungs. So again, we have to work on that kind of condition as well. So now in all these stages, let it be mild COVID, moderate COVID, or severe COVID, the role of chest physiotherapy is very, very prominent. Now, when we talk about the respiratory diseases, to make it more simpler for everyone who is listening to this, we all know that respiratory conditions are widely divided, or broadly divided, into obstructive diseases and restrictive diseases. Now, obstructive diseases, I'll just not go much in detail with that. That is like you can smoker's lung, or COPD, bronchitis, all those things comes into respiratory obstructive diseases, in which there is more of hyperinflation of lung. The other part of the disease that is called as restrictive disease. Now, before this COVID-19 pandemic, the load of restrictive diseases entirely, or you can say globally, was very much less. But this pandemic has actually increased the load of restrictive diseases, and this COVID-19 affects the lung in such a way that it leads to a restrictive condition in your lung. So basically, pulmonary fibrosis is one of the terms that we use for the severe cases who get affected by it. So the protocol that we follow as a chest physiotherapist is more of a restrictive disease. And that's how since you asked me about the role of a chest physiotherapist, so just not in the post-COVID rehab, from the time the patient is detected from a COVID-19 infection, the role of a physiotherapist is very significant in preventing the fall of the oxygen level in a patient. So in case if you know anyone who is quarantined or just got affected by COVID-19 patient, start your breathing exercises, positioning, and everything possible to make that patient maintain their oxygenation. And of course, from the time the patient is admitted in the hospital, in the ICU, or in the ward, in the IPD, the role of a physiotherapist starts from that. And once the patient is recovered, then from there, the actual work of physiotherapist starts, because then the post-COVID rehabilitation is the most important thing that will actually make the patient get back to the normal activity. So I'm not specifying it much, just as a general, if we, since we are talking more about post-COVID rehabilitation, for a patient, the COVID recovery is like, if you ask a patient that whether you have recovered or not, he will say that, yes, now I'm COVID negative and now I have recovered from the infection. So that's what, as in a layman language, that's what even we will say, no, I'm a recovered patient now. My reports came negative and I'm fine now. But actually the exact recovery is when your lungs are as healthy as it was before, when you're able to do your daily activities without getting breathless, when you're able to use your muscles, because of course COVID-19 affects your strength and endurance as well. It reduces your strength, it weakens your larger muscles of the body because of the lack of oxygenation. So when all those things are getting back to normal, then a patient is actually recovered. And once the patient is out of COVID-19 infection, the main role is only of the main role is all in the hands of a chest physiotherapist, and that's what our role is, and that's why it's more prominent now. So I hope that's a bit clear.
Okay, Samana, thank you for that really explanatory answer. So I'll move on to the next question. Can you tell us some more effective post-COVID exercises? How are they beneficial?
Okay, so talking about the post-COVID exercises, as I said, it is entirely individual based, because this infection is not showing any kind of uniformity in every patient. Every patient comes with a different symptoms, different areas of affection. Mainly now, if we'll talk about the lung part, it affects, in the severe cases, if you will see, it affects the bases and the peripheral areas of your lung. Now, I will, like practically, since I can't bring a real lung for you, I got this. I hope that works. So now, see, the first thing when the patient is in ICU or when the patient is getting recovered, you will see most of the COVID-19 patients are usually breathless because of the fibrotic changes that are taking part inside the lung, or because of the pneumonia. So the first thing which is important for them is positioning. Since there is a lot of hype about prone positioning, I would like to really start with that only, because that is something which has been a life savior for a lot of patients. Now, since I'm from India and we are all over in news because of the second wave, seriously, because this time the second wave is entirely, I won't say entirely, but yes, a lot different from the first wave. So all those who are from India or who are not from India, I would just explain a bit of like whatever is different between that. During the first wave, we had got a good window period for the aggravation of symptoms. Like, we could have, we used to measure like, okay, after 5 days, the patient can get severe. Then on the 7th day, the patient will get into cytokine storm, 7 to 11 days. And then after that, after 14 days, the recovery starts. Now, this double mutant virus, which we are finding and which is like spreading like anything, like a wildfire, this is not giving us enough window period. Like, it is not giving us enough period for a patient to actually, try to keep that think, okay, now we are in mild and now let us just get there, try to wait and keep the oxygenation on check. Mostly, if we will see, within 2 to 3 days, a lot of patients are going into respiratory distress. Now, when we talk about respiratory distress, what we can do with such patients is we can try to give positioning, which is called like commonly used term nowadays, everyone which we are talking about is prone positioning with these patients. Now, why we are focusing a lot on prone positioning? The reason being is this virus affects the basal areas of your lungs. Now, usually when we are doing any kind of breathing, like now when I'm talking to you, and the way we lie down, the way we do our breathing exercises, we don't focus on the lower areas that much. Now, the thing is, even when we talk about breathing exercises, the first thing that comes in our mind is diaphragmatic breathing. Basically, even in this colleges during our course and all, also we are being taught that, okay, lower basal expansion is more about diaphragmatic exercises. I have heard a lot of students talking about the same thing, but that is not the actual case. When I talk about basal exercises, the diaphragmatic along with the lower basal exercises. So why prone positioning is effective and helpful? It is because this is the lower part of your lung and this is your entire lung. The positioning of the lung in our body is slightly like this. The anterior and the middle part is more in the anterior part, and the lower basal is more on the posterior part. Got it? Wahan pe bhi, like if you'll see over there also, there is our we have our heart over there, which again compresses the basal areas. So now when we go on these on a prone position, or you can say when you lie on your stomach, the basal areas are expanded more, and that's what we need when we have any kind of COVID-19 infection. So even if you guide your patient, even if the patient has got COVID-19 or is recovering, if you guide your patient to just do deep breathing exercise or just try to deep breathe, you must have seen videos where they show you to just take a deep breath, hold for 10 seconds. And if you're able to hold it, you're not having COVID or your lung is strong. We don't follow that concept. And frankly speaking, I have seen patients who can do that and still they go into respiratory distress. So let me just clear this fact, because we are seeing COVID patients since 1 year, and still we get a lot of queries who say that, ma'am, I can do this and I don't think so I will get my lung infected. So that is wrong. So basically, even if you can do that, even if you're doing deep breathing exercise, you are holding it, you are really not working on your basal area, which is mainly on this side. So the only thing that can help you to improve the oxygenation is lying on your prone position, that is on your stomach. Now, when you do this, you have to be very careful whenever you tell this to your patients. You have to take care of few contraindications, which is very important, and also you have to explain them a proper pillow position that is just on the pressure areas. They can put a pillow below their heel, below their calf muscle, below their shin. Keep one pillow below the chest. Keep one pillow below the head. That's all. It is very much patient variant. You will be seeing a lot of pictures of different pillow positions for different patients. It's entirely patient based, but you have to really take care of the contraindications, like if the patient has got any spinal issue, any heart disorder, pregnancy, spinal instability, or any kind of low blood pressure. We have seen a lot of patients, and we have seen a lot of other medicos also forcing the patient to lie on prone position even when the patient is not able to maintain it. Again, that is something wrong, because if you have any kind of heart issues or blood pressure issues, then it can again aggravate some other condition other than COVID-19. So these are few things that you need to understand. Why I started with post-COVID exercise, when you asked me about post-COVID exercise, the reason why I started about with this prone positioning is because that is the most common question that people ask me nowadays. My entire WhatsApp and everything is filled with those questions, because people are still confused with the fact that why we want a person to be lying on prone. But since we are dealing with a huge wave in our country, we have seen patients coming up really well with this. Like suppose even today morning only, I have seen one patient whose oxygen was 90, and after 2 hours of prone positioning, it came to 94. So that is the effect of prone positioning. So that is one thing as a physio which you can guide everyone without going or meeting the patient to save someone's life. Now talking again, coming back to post-COVID exercises, whenever you get the CT scan of the patient, you have to definitely check the areas where the disease has progressed more, and mainly it's in the basal areas. So when we talk about the post-COVID exercises, definitely breathing exercise is one of the most important part of it. You have to work on the segmental expansion. Basically, I will not be going much into detail of the basic exercises that we know, that is diaphragmatic exercises, or your chest expansion exercises, your basically lateral expansion exercises. This is something that we all have been learning and knowing and making our patients do since long. Now, when you will see any post-COVID patient, a patient who has really recovered from a pneumonia or a respiratory distress, trust me, it is not easy to make that patient do a deep breathing exercise. I may teach you, I may tell you, okay, fine, ask the patient to take a deep breath, ask the patient to hold. It is not possible. So how we start with it? The one of the best exercise that I teach my patients, and which really shows amazing result, is breath stacking exercise. Now, how you go about with it is very simple. You can teach it to all your patients. The main funda, or you can say the main purpose of doing this exercise, is to improve the lung volume in the patient. And those patients who are unable to take a deep breath in, or who are unable to do deep breathing with proper holds, this can actually help them to gradually increase their inspiratory capacity. So all you have to do is you all can do it with me. A lot of you must have followed my YouTube, those who follow me on YouTube channel, I've seen a lot of them have registered. They must have seen it on my YouTube video also. Those who have not, please follow it with me. All you have to do is, before that, let me just tell you, whenever you will see any COVID-19 patient, their breathing pattern is more or less is like this. So even if you'll ask a patient to take a deep breath, they can just take it up till this much level. Holding for them is really difficult. So what we do is we break it into different pieces. Now, breath stacking means you're stacking one breath above the other and then the third breath above the second breath. So how you will do is just sit straight, take a very small breath. Don't try to take a deep breath. Hold it 1, 2, 3 as much as you can, as per your patient's limit. Now, don't blow it out. Try to stack another breath above it. Again, hold it for 1 or 2 seconds. Don't try to breathe it out. And again, take or stack another breath above it. Hold it 1, 2, or 3, and then blow out as much as you can. Do you want me to repeat? So it is again, take a small breath, stack, stop it. I hope that's clear. You want me to repeat it? So it is just stacking a breath so that you increase the volume of the patient. That is how you start beginning the exercise program in any kind of COVID or post-COVID patients. Once the patient is able to take a small, or you can say once you feel the inspiration of the patient has improved, then you can ask the patient to start with your basic diaphragmatic breathing exercise or chest expansion. That is one thing. Before this, you may also see that your patient must be having difficulty even doing a normal small volume breath as well. So in such cases, try to give a lot of blowing out before initiating any kind of inspiratory movement or inspiratory action or inspiration. So all you have to do is give a lot of relaxation technique to your patient, which includes more of expiration. That is, one of the technique that we also follow is just blowing out in the balloon and then breathing in, blowing out in the balloon and then breathing in. So that is something you can again give it to your patient who are on a home exercise program as a post-COVID exercise. Again, coming to the next exercises, thoracic expansion, like including combining your thoracic movement with your arm movement, which most of us know, that is breathing in with your arms raised and blowing out. Again, breathing in with your expanded chest and blowing out. Now, when you give this to the patient, we have observed in past 1 year, and this we have even observed in other pulmonary fibrotic cases, a lot of patients report a drop in their oxygen. So basically, and this is some of the commonest exercises that a lot of students give to any kind of cases who are prescribed for chest physiotherapy. So what we do in COVID patients, we never start with upper arm movement immediately after the patient has recovered from any kind of COVID infection, if the patient was on any kind of oxygen support. So initially, how you have to work is start with positioning, start with the basic breathing exercises, breath stacking, diaphragmatic, chest expansion, and then start with, after 3 to 4 days, check for the oxygen drop, and then start with the upper arm thoracic mobility. After 1 week, if the patient is maintaining the oxygen, do a 6-minute walk test to see whether the patient's oxygen is dropping or not, and then you can start with the general mobility exercises. So you have to just be very careful with the type of training you are giving to a patient. That is interval training. Never force a patient ki chalo karo, you have to do the exercise, come on, like how we motivate our patients with musculoskeletal diseases, like, like, no, you have to finish this target in 1 minute, come on, you have to do 10 rounds in 2 minutes, you have to finish 5 rounds. You can't do this with any kind of fibrotic restrictive case or any kind of COVID-19 condition, because there can be a sudden drop in oxygenation. So interval training is one of the best training if you have to give any post-COVID rehabilitation program. And this program usually comprises of almost 6 weeks. Like you have to give a 3 months of program to this patient. First 3 months will only give the maximum results. Whatever you can gain, you will be gaining in those first 3 months. After that, it will be all plateaued. So whatever reversible process that can happen in a person's lung will be within those 3 months. So those 3 months are really crucial for your post-COVID patients. Yeah, I hope that's clear.
Okay, Samana, thank you for this really interesting demonstration and busting some myths. So my next question to you is, what are some major contraindications to post-COVID rehabilitation?
Okay. So basically, there is no contraindication as such for a breathing exercise. But yes, when it comes to a rehabilitation, there are few contraindications. First thing, when we talk about chest rehabilitation, I need to specify it once again that it doesn't mean that chest or cardiopulmonary physiotherapy is just not about breathing exercise or chest clearance or percussion or anything like that. It's a, you can say we have a lot of things which is included in a chest physiotherapy. When we talk about a cardiopulmonary physiotherapist, that means it is something, or you can say this stream of physiotherapy, it deals with the patient's entire aerobic capacity. Now, when we talk about aerobic capacity, it doesn't just include your heart or your lungs, that is your cardio or the pulmonary part. It includes all the muscles of your body, right? So now, again, going back to COVID-19 infection, as I said, the COVID-19 disease doesn't just affect your respiratory system, but it also deteriorates your entire muscular system as well. There is atrophy in your muscles, especially in the larger muscles of your body, especially in quadriceps, hamstrings, calf muscles, your upper body, that is your deltoid muscles, your core muscles, your accessory respiratory muscles, because they have to really work hard to, cope up with the oxygen demands of your body. So basically, talking about the entire rehabilitation part means working and dealing, also strengthening the entire musculoskeletal system along with your respiratory system. Now, there is something which is called as post-viral fatigue syndrome, which is something similar like chronic fatigue syndrome, which we have seen in myalgic encephalitis as well. So what happens in this condition is, over the last 1 year, we have seen a lot of patients who just don't get better even after 3 months of continuous physiotherapy treatment. We do try to basically, whenever you start any kind of cardiopulmonary activity or any kind of rehabilitation, the patient starts showing improvement in their dyspnea, overall performance, daily activities after 1 month or 45 days of treatment. But if your patient is not showing any improvement after 3 months, 4 months, or 5 months of treatment, then you are supposed to stop the treatment, because your patient can have myalgic encephalitis, or which is again a complication of COVID-19, which was seen initially when this disease started, or the patient must be having post-viral fatigue syndrome or chronic fatigue syndrome. And giving any kind of exercises to this kind of patient can actually disturb their cardiopulmonary and metabolic system. So in such cases, it is very important that you report it to the physician, and you have to keep the patients very much hydrated. So this is something where we need to restrict our activity, our role. And now the main thing comes, like how you will understand whether the patient is having this or not. All you have to do is try to give, as I said, that you have to put the patient on interval training. Try to keep on noting the progress of your patient every 15 days by functional assessment, 6-minute walk test, sit to stand test. There are a lot of functional tools that you can use for the patient. And if you don't find any improvement in those 3 months, or the first 3 months where I said that you can get the maximum gain from the patient, then you have to stop that treatment, and you have to really work and, or get the other test done, talk to the physician and see what is to be done. So that is the only contraindication as such. Rest, physiotherapy is a must in a COVID rehabilitation and a post-COVID patient.
Okay, Samana, as you said that prone positioning has a lot of impact on COVID-19. So could you let us know that how useful it is proving to be?
I think we just spoke about it, but yes, I can again, as I again elaborate it, because now prone positioning is something that is hyped everywhere. That is one thing which is on, which is in the news, in the articles and everywhere. So yes, we just spoke about it, but prone positioning is something I would advise to anyone and everyone who is suffering from COVID. All those who are not having any kind of oxygen issue also, if their oxygenation is maintained, saturation is maintained, even at 98%, I would advise them to start prone positioning so that it is not getting deteriorated. That is one and the only thing that can prevent your hospitalization. So combining prone positioning with deep breathing is a real smart idea to actually keep the oxygenation up to the mark and prevent the fall of oxygenation. If your patient is stable, you can ask the patient to do deep breathing exercises or just a good deep breath with a hold, even in the prone position. So that's how you can work on it. But I think we have discussed about it quite in detail. So.
Okay, Samana, yes. So in your opinion, is traditional treatment more effective or one should stick with new emerging techniques?
Okay. So like any other field of physiotherapy, chest physiotherapy has evolved over the decades, and there have been a lot of changes in the perception of this field as well as in the treatment of this field. Initially, when we used to talk about chest physiotherapy, it was all about just breathing exercise and chest percussions, as I said and mentioned earlier. But now, as the researchers have come and as the new techniques and everything has come, it has evolved in its treatment, and now it is just not about, as I said, it's just not about the breathing exercise or just about some manual positioning or just some about manual percussion or techniques that we do in chest physiotherapy. There is a huge contribution of equipments that that actually helps us to really improve the patient's condition. So when we give any kind of chest physiotherapy to our patient, our treatment usually includes a lot of usage of respiratory muscle trainers. There are a lot of companies which are developing these like power breather and all that, which produces inspiratory muscle trainers, expiratory muscle trainers for your patients. Now, when it comes to COVID patients, inspiratory muscle trainers are usually very effective, which you can give along with your basic traditional exercises or your traditional breathing exercises that you give to your patients. Now, we all know this is something which is very basic and handy for all the patients. Without incentive spirometer, I don't think so you can treat any of your COVID patients. And this is the Waldine model that I am holding. This is this is the latest one, and I think everyone should use this only. So if you have a good spirometer, that is the first and the most important equipment, handy equipment that you should give it to your patient. Along with that, definitely talking about the new techniques. If your patient has got cough, then we have vibrators, that we vibrator oscillator machines that we use for our patients. So basically talking about this is now we have combined cardiopulmonary physio. We have when we talk about cardiopulmonary physiotherapy, it is a combination of musculoskeletal, neurological, as well as cardio and respiratory systems. So talking about this, we have to take care of everything when we give or plan a treatment for our patients. Now, you will say, what is neurological part has to do with this? Now, if you will see, hypoxia is one of the most important thing that we are seeing in a lot of COVID-19 patients. So hypoxia doesn't just affect your respiratory system, it affects your musculoskeletal system as well as your neurological system. You will be seeing a lot of patients even come to us with psychosis or post-COVID psychosis as well. So definitely all of these is, or you can say the assessment of all these branches are very important when you are dealing with any kind of COVID-19 condition. So I think, yes, we have to combine the traditional and the new techniques so that you can design a proper individualized protocol for your patient. Are you there, Habiba?
Okay, Samana. So my next question to you is that what home plan would you suggest must be given to patients post-COVID rehabilitation? Are there any exercises for patients who have recovered to prevent COVID-19?
Okay. So first thing is, whenever you are planning or designing a COVID patient protocol or a chest physiotherapy protocol for a patient, first thing that you have to think is about loading the respiratory system gradually. Fine. So that's how you will plan your entire protocol. Relaxation and breathing control techniques will be the prime thing that you will be teaching your patients, because fatigue or post-viral fatigue, as I said, is very, very common in these patients. Dyspnea leads to breathlessness. That's why they restrict doing a lot of other movements and activities. So first thing that you have to include in your home exercise program is relaxation and breathing control. Second will be your breathing exercises as per the involvement of the chest. Now, suppose this if I divide my lung into upper, middle, and lower limb, and suppose I have a patient who just got a mild condition, and only you are finding some patches over the upper areas of the lung, or on the lateral areas of the lung, or just the lower areas of the lung. Now, accordingly, seeing the CT scan and the X-ray, you have to design the protocol for your patient. We do know postural drainage positions where we try to position each areas of your lungs. Similarly, you can do with your breathing exercises also. Give patient the postural drainage position and make your patient do breathing exercise or deep breathing with holds in that position, and give spirometer in that position. Now, just for an example, if my lateral area is involved, I'll make the patient position in the lateral side, and in lateral position only I'll give the spirometer with holes to my patient, so that I focus in expanding the areas which are affected more than just giving any kind of generalized breathing exercise to my patient. That is one thing. Now, in the first wave or 1 year before, when this COVID-19 occurred, usually a lot of patients, there were very less cases of cough, like patients or secretion. So the secretion was really not the common thing in the first wave of COVID. But now when we are seeing cases like the second wave in India, I'm talking mainly about because we are dealing patients every day over here. Patients are coming up with a lot of secretions, which was not there before. So now even giving a good postural drainage positions with percussion, manipulation, and a good coughing and huffing technique is very, very important for these patients as well. So active cycle of breathing technique is something you can advise to your patient. You can tell your patients to do that, follow that at home. And if you want to know about this, an active cycle of breathing technique video is there on my YouTube channel, Physio Lab by Dr. Samana. You can go there and find the entire video. It is like entire practical of that. So that is something you can give as a home exercise program to help, which will help them to drain their own secretions. Now, other than that, upper limb and lower limb exercises, because definitely you have to work on the strength and endurance of the patient. But when it comes to your limb activity, you have to start with the lower limb. Never start your upper limb exercises in a COVID-19 patient, because that will increase the respiratory load of the patient, and that will make the patient more breathless. So always start with the lower limb training. Once the patient is fine, you have to continuously monitor the BP and oxygen saturation of the patient. If everything is in place, then you have to start after 4 to 5 days or 1 week, the upper limb training in those kind of patients. Other than that, as I said, that we have to work on improving the overall aerobic capacity of the patients. So you have to put your patient on a good interval training, and weekly there should be a progress in the exercises. At least you have to give 4 to 5 days for each kind of exercises to get accommodated and adapted by the patient. And with those exercises, the oxygenation should be maintained well. Now, even with spirometer, even if the patient is outside ICU, the patient's oxygen is 98 or 97 at home, but the patient had a CT score or a CT scan severity score of about 10, then you have to still give spirometer to that patient at least 4 times a day. A lot of patients stop doing it after their discharge or after like 20 days of their recovery, thinking that, okay, fine, now my oxygen is maintained, so I don't really need to do any kind of breathing exercise or the spirometer. But frankly speaking, their oxygenation is maintained, but the areas of the lungs which are damaged or those fibrotic patches are still there. So basically the lung is not expanding entirely. Those areas are still lacking the oxygenation, which can really, aggravate the condition or make their aerobic capacity deteriorate over the years, which they may not understand now. So that's how counseling is also very important. And it is again a very crucial, the physiotherapist plays a very crucial role in counseling the patient to understand how important the first 3 months are there in their recovery. So as I said, loading the respiratory system gradually, including the entire exercise program, which includes your respiratory, your cardiac, your respiratory system, which includes your musculoskeletal system and your neurological system.
Okay, Samana. So my last question to you is that what role are you playing as a healthcare worker in COVID-19?
So we started we got in India, COVID-19 started in last year, March, around when we had just I think 1,000 cases. And I started taking, as a COVID worker, I was the first one in India who started taking COVID workshops and lectures, because that was the time when we were not having enough cases in India. And basically the physios were also confused about what is to be done. And since I am into chest or cardiopulmonary physiotherapy for years, so for us, dealing with pulmonary fibrosis, restrictive diseases, and previous viral infection was something that we saw. So I am working as a COVID educator since 1 year, more than 1 year, and I have taught almost 3,000 students in India, and almost 30,000 plus students and professionals globally in this entire period of pandemic. Along with that, I have started. I've started working as a COVID warrior also, and till now I'm working as a COVID therapist, online, offline, in IPD, in ICU, wherever and whenever required. So I think that's enough, because being a COVID educator and COVID therapist is what I am doing, and what exactly is my role in this. And I think every physiotherapist is really contributing a lot in this pandemic, selflessly, and trying their best to do it. Initially, you also must be knowing the chest physiotherapists were not that people were not much aware of this thing. There was a lack of awareness about chest physiotherapy in common people. We used to even get questions before this pandemic, like, what exactly do you do in chest physiotherapy? Do you give ultrasound over the chest? Do you give IFT machine, or do you give manipulation over the heart? So those were the questions that people used to ask us. But now this pandemic has made people well aware of this. And yes, I have been working a lot in awareness of the common people and the physiotherapists, and working as a COVID therapist, along with being a part in research and all. Yeah.
Okay, Samana, so we are really grateful to have doctors like you around us, and you guys are really working as heroes and saving lives. This is really great. So now, before moving on to our next speakers, we will be taking questions from the audiences. So I will be taking a maximum of 3 questions. So Samana, my first question to you is from Hitesh Balwani, and he's asking, if COVID patient is unconscious, which exercise to perform?
Well, if the patient is unconscious, that means the patient is in the ICU, right? Because basically patients are sedated, and such kind of patients are basically in the ICU. Now, when being a physiotherapist, we have a very limited role in the ICU. It all depends on the patient's severity. So basically, if the patient is into respiratory distress or having any kind of condition where the patient is really not responding, positioning is the only thing that we can do. Now, again, if the patient is unconscious and is on ventilator, then we have to decide our role. If the patient is on a higher PEEP, that is something about 10 centimeter of water, then basically we are very much limited and restricted in our chest therapy. And for such cases, basically only prone positioning is advisable. So basically for the patients in ICU, our role limits, because already the patient is having a higher PEEP, and we are not supposed to increase the work of the breathing. So our manipulation, or our activity, our therapy can increase that. Unless the patient is having any kind of secretions, our role is limited in ICU if the patient is on higher PEEP, or if the patient is having respiratory distress. Once the patient is out of it, then basically our role starts significantly.
Okay, so there's another question. Is MHT technique useful for COVID patient?
Is what?
Is MHT technique useful for COVID patient?
Well, you will have to just write it. Okay. Can you just tell me AHT? AHT you're talking? I can't.
MHT, yeah.
Okay. So it depends entirely on the case again. Frankly speaking, definitely I cannot really say that. It is very much individual based. As I said, that every patient has got a different characteristic. Now, all the patients shows different symptoms, and even the 2 patients who are on ventilator will never have a same kind of physiotherapy, a same kind of treatment protocol. So it entirely and completely depends on an individual, their underlying condition, their comorbidity, the amount of oxygenation they require, the amount of the oxygen fall they have, and the amount of the liters of oxygen or the other support that they require.
Okay. So my next question is, if patient is on oxygen, which exercises can be done? And if prone positioning is contraindicated, then what can we do to improve oxygen level?
Okay. If the patient is on oxygen, you can do all the breathing exercises, keeping that oxygen mask on. Don't even try if the patient is having oxygenation below 85. Don't even try to remove the oxygen support of the patient just for your exercises. First thing, what you can do is if the patient is on an oxygen mask, you can put the patient on the nasal prong for doing your exercises. That's what we follow in the hospital setup. That is first thing. Second thing, a lot of patients who are conscious and on oxygenation are unable to follow prone positioning. So for such patients, if they are not willing to do or they are not cooperating with it, you can go for sideline position every 2 hours. That is the only thing that you can do for them. So, but just don't let them be on a straight supine position. Keep two pillows, give them crocline position, and more often the sideline position. That is fine. That's the only thing you can help them with the oxygenation part.
Okay, Samana, thank you so much for joining us today. It was a pleasure having you. So at this time, ladies and gentlemen, I would like to introduce our second speaker, Dr. Nida Rizvi. She is known for many international publications on intensive care unit and COVID-19. She has an experience of working with various ICUs and is an internationally certified physiotherapist. At this time, I invite Dr. Nida to take over. She will be speaking about COVID-19 rehabilitation. Hello, Nida, can you join us?
Yes, Habiba, I'm listening. Thank you so much for giving such a brief introduction. Thank you so much. We can proceed towards question and answer session.
All right, Nida. So my first question to you is that I would like to ask you that what role are physiotherapists playing in COVID-19 intensive care unit? How are you all dealing with the ICUs at this crucial time?
Okay, Habiba. Physiotherapists are playing crucial role in this difficult time by working head to head with medical team. If we talk about the role of physiotherapist, it starts when patient enters the ICU. It starts in patient, and physiotherapists must work safely using PPE, that is personal protective equipment. If we talk about the role of physiotherapists are involved in improving work of breathing. Physiotherapists are involved in mucociliary clearance. Physiotherapists are involved in improving the deconditioning. Physiotherapists are also involved in improving the work of breathing, targeting the lung volume capacity, improving early extubation, mucociliary clearance, improving mobility status, quality of life, and most importantly, physiotherapists are involved in improving the mobility and improving the activity of daily living.
Okay, Nida. So my next question to you is that can you please tell me which one of the techniques in ventilated COVID patients do you think is more effective? Is it the traditional physiotherapy approach, or are the new emerging techniques helping COVID patients with improved quality of life and speeding up their recovery process?
Okay, Habiba. If we talk about the physiotherapy techniques, first of all, history taking and examination is very, very important for a physiotherapist. Like I have seen in my clinical practice, including me, due to lack of time, we lack in this domain. As a physiotherapist, we must be performing history taking by looking over the previous notes. If I talk about the ventilated patients, our target should be on the ventilator parameter. Like few days back, one of my friends was laughing on this fact that why physiotherapists are working over ventilator. They have no role. This is a lack of evidence-based practice, which I believe. So always target over the mode of ventilator. Like if we talk about mode of ventilator and parameters, we always target about what type of volume support or pressure support mode we are using. What is the value of the PEEP we are using? What is IE ratio? IE ratio is very, very important for a physiotherapist. Whenever we talk about manual physiotherapist technique, our target should be on IE ratio, that is inspiratory to expiratory ratio. Like no physiotherapy manual techniques are possible without IE ratio. And similarly, respiratory rate has its own importance. Like if respiratory rate is set high, so we have the chances to exhale more carbon dioxide. Similarly, if respiratory rate is decreased, we have the more chances to retain carbon dioxide. Okay, Habiba, can you check? Can you see me?
Hello, Nida. Yes. So Nida,
Can you hear and see me?
I cannot see your video actually.
Okay,
Can you
let
turn
me
on your
continue,
camera?
Habiba. Okay, let me continue. Like
Okay.
if we talk about the ventilator parameters, we must target about the mode of ventilator, PEEP, what is the IE ratio and respiratory rate. Like if one have no idea about how much FiO2, PEEP, IE ratio is set, I cannot be accurate in giving manual physiotherapy technique. For example, if I have to give thoracic compression, we all are familiar with thoracic compression that we give it by using interdigital techniques. In thoracic compression, if IE ratio is 1:3, then my focus will be that over the end of inspiration to whole expiration for 3 seconds. Like in whole expiration, I will be giving thoracic compression for 3 seconds. In such way, lung expansion will be done. And this is very, very, very much improved. This shows very much improvement in patients who are of COVID-19 and admitted in intensive care unit. If I have no idea about PEEP, I cannot be accurate about manual hyperinflation technique. Manual hyperinflation technique is dependent on PEEP. Like if patient is on zero PEEP, then I will also have to set zero PEEP on my manual hyperinflation. As we all are familiar that manual hyperinflation leads to increase in intrathoracic pressure, which decrease the venous return, and it leads to the decrease in arterial pressure. So we must be very much cautious regarding manual hyperinflation technique in mechanically ventilated patients. Passive chest physiotherapy by seeing parameter of ventilator is very important. Like if I talk about the passive chest physiotherapy technique, one of the most important technique is percussion. Like if I have to perform percussion, mostly good position is prone positioning. In prone positioning, our target is on lower lobe. Always target lower lobe in COVID-19 patient, as lower lobe has more chances of getting collapse in COVID-19 patient. So what I have to do, I will make the patient in prone positioning, which Samana has already discussed in detail. And after having the patient in prone positioning, I will be using cupping method. Cupping method is very much effective at is percussion. After giving percussion, patient we will see that patient oxygen will increase so much. After giving manual techniques like percussions, compression, we will target towards the mucociliary clearance, which is the main domain of physiotherapists too. Like inline suction is the safest method if we use, and one should be very cautious regarding inline suction method too, as it is the aerosol generating procedure. Take maximum protection, wear extra apron or green gown over PPE whenever performing such aerosol generating procedures.
Okay, Nida. Nida, I would like to request you to turn on your video, please.
Okay, so PPT, can you see my PPT?
Yes. Can you? Okay. So Nida, my next question to you is that what is the role of physiotherapists in acute care of patients extubated or on oxygen dependency?
Okay, so traditional physiotherapy have their own importance, but I believe physiotherapists should use evidence-based practice or emerging physiotherapy technique. If we talk about the patients who are extubated or are on oxygen dependency, then our target should be on improving work of breathing and preventing deconditioning. We must know that patients are at high fatigue level, so always target those exercises which can give relaxation to the patient. So whenever I perform in my clinical practice, my first target in acute care is to perform diaphragmatic breathing. Diaphragmatic breathing is performed by asking the patient to breathe in. After breathing in, we will ask him to see his abdomen will move upwards. Similarly, whenever he breathes out, as we can see in the picture, that if we breathe out, abdomen will go downward. So the importance of diaphragmatic breathing is that it helps in improving respiratory muscle control. It helps in improving the work of breathing, but one must target that accessory muscles shouldn't be used. Similarly, if we see the second technique which we can see on this screen is the pursed lip breathing. If we talk about pursed lip breathing, we can perform this technique especially in hypoventilated patient or to improve expiration in the patients. So as to overcome the carbon dioxide retention, as we can do it in COPD patient, like if any patient is having a COPD along with COVID-19, so we can perform this technique. In this, we will ask the patient to inhale, and then pulse or whistle his or her breath, his or her lips, and then breath out slowly. So this technique can easily help in improving work of breathing. Okay, Abhiva, can you move towards the second slide? Okay, another technique which Samana has already discussed in detail is the breath stacking technique. So I will not discuss it further. As Samana has discussed, it's important. It is very much important, especially in those patients who are unable to do inspiratory exercise. We can perform breath stacking technique. Similarly, can we move to our next slide? Similarly, if we talk about another technique, which is one of the most emerging technique, it is alternate nostril breathing. Alternate nostril breathing, for this, we can perform asking the patient to take breath from right nostril, then close left nostril from hand, and now exhale from left nostril and then vice versa. This technique is very much important in improving respiratory rate, expiratory capacity, and oxygenation. A few months back, I did a research on our effectiveness of alternate nostril breathing and pulse lip breathing. From my data, I got to know that alternate nostril breathing was more effective as compared to pulse lip breathing. We use outcome scale like Borg scale, and we got to know that oxygenation was improved in COVID-19 patient by using alternate nostril breathing. Okay, now we can move to our next question.
Okay, Nida, thank you for your answer. So now my next question to you is that, can you tell me the role of physiotherapist in recovery stage of patients?
Okay, Habiba. So if we talk about the recovery stage, like we have already discussed that if patient is on ventilator, we will perform such percussion compression technique. Now, as patient is recovering, now we can go towards the respiratory muscle straining exercises, strengthening of respiratory muscle. Even as we know that on when patient was on ventilator, we were doing exercises to prevent from deconditioning, but now patient conscious level is much better. So now we will go towards the muscle joint integrity exercises, PNF exercises, and improving muscle tone exercises. So if we talk about the recovery stage, what I target in my clinical practices is doing ACBTs, but yes, we will be very much cautious regarding breath hold exercise. After that, we will target over the lateral coastal breathing exercise. As we all know, lateral coastal breathing exercise always target each and every lobe. So it is very much important for the patient. Secondly, I can perform manual mobilization technique, PEP exercise, like positive expiratory pressure techniques like flutter and other techniques are also very much emerging and have their importance. But we should be very cautious as patient of COVID-19 have high fatigue level. So we should always work forward the fatigue level and check the comorbids and fatigueness level of these patients. Secondly, one of the most important technique, if you can move towards the next slide, we can demonstrate. Okay, most important exercise, which is one of the new and emerging technique, is autogenic drainage. It has 3 steps: unstick secretion, collecting secretion, and evacuating secretion. If we talk about these, basically our target is to take slow breath, then take mid breath, and then take large breath. Basically, it is helpful in clearing secretion. Another technique is incentive spirometry. Incentive spirometry, as Samana has already discussed, targets towards the inspiratory reserve volume, and it is very much effective. Like if I talk about incentive spirometry, by reviewing many literature, I got to know that if one patient is able to hold like 600 cc ball for 2 seconds, then I will multiply 600 to 2, and it will show me inspiratory reserve volume, that is 1200 if we multiply. Or you can also use any other example, like if I take 700, this patient is able to maintain 700, then after multiplying it to 2 seconds or any other hold, then we will be able to know the inspiratory reserve volume. So it can be used as a outcome measure for seeing how much improvement patient is showing. So these are the exercises which we can use in recovery phase.
Okay, Nida. So my next question to you is that, COVID-19 has affected people of all stages, ages, and may be infants, children, or adults. So what has been the role of COVID-19 rehabilitation in the pediatric population?
Okay, so almost every student of mine asks me that what is the role of pediatric physiotherapists in assessing or in helping pediatric population. As we all know that nowadays we are seeing many patients of pediatrics having COVID-19. If we move towards the second slide, we can easily correlate with our findings that that pediatrics are having same targets as adults, but our target should be gently. We will perform exercises little gently, like posture drainage positioning. For posture drainage positioning, bed lung will be always above, and in side lying. Okay, any problem, Habiba? So we can sort it out. No problem. You can take time. Yes. So we are talking about the COVID-19 physiotherapy for pediatric patients. Our target will be same as adult. We will improve work of breathing. We will work over the oxygenation, mucociliary clearance, improving and preventing from deconditioning. And we will use we will use techniques but little gently. As you can see on this screen, tenting method is used. Like we are using 3 fingers in pediatric population because they are little more gentle population. So we will be quite gentle in using our techniques. So if I talk about posture drainage positioning in pediatric, what literature says is prone positioning is important, but sideline positioning is very much more important as compared to prone positioning. So what we can do is, first of all, in sideline positioning, bad lung will be in above positioning and good lung will be down. But in such way, oxygenation will be improved and ventilation perfusion will be improved. Similarly, for percussion tenting method, which I have seen, which you all can see on the screen, tenting method, we will use this method for percussion. And similarly, Habiba, can you move towards the next slide? So I will tell, yes, similarly, for compression, we will use 2 hands method. This is very easy method and can easily perform in the end of inspiration to start off and throughout the expiration. Okay, if we move towards the recovery phase of pediatric population, so our target will be towards the play-based therapy. Like we will use play-based techniques which can help the patients to improve their inspiratory and expiratory capacities. Like in play-based therapies, we can ask them to blow bubbles, inflate a balloon, blow small pieces of tissue paper. And similarly, one of the most interesting and which provides soothing effect is the bumblebee breathing. For bumblebee breathing, we will ask the patient to sit comfortably, place one hand over the ear, and then we will ask him to take the deep breath in and do it in a humming effect and then exhale out slowly. So this is bumblebee breathing, which pediatric population do very effectively, and it also have the soothing effect and it can improve the inspiratory and expiratory capacity. So whenever we target the pediatric population, our target should always be towards the play-based therapy, so they can easily cooperate with us.
Okay, Nida. So my last question to you is that what advice would you like to give for therapists working in ICU?
Okay, so I have seen in many clinical practices, we got to know from many physiotherapists saying there is no role of physiotherapist in ICU. Why are you working in ICU? There isn't any role of physiotherapist. So we must work together in such things that we must target evidence-based physiotherapy techniques to improve our cardiopulmonary practices. We must understand that cardiopulmonary physiotherapy is equally important as compared to other domains of physiotherapy like neurologists, musculoskeletal, orthopedic physiotherapists, and pediatric physiotherapists. And most important thing, if we are not sure or not excellent in any technique, we must take guidance from others. And most importantly, don't use such words like physiotherapist का क्या काम है ventilator या history examination से, या physiotherapist क्यों भाई extubation करा रहा है, आप तो physiotherapist हैं, range of motion exercise कराएं, active cycle of breathing technique कराएं. So we shouldn't use such thing, as we are moving towards the evidence-based approach. So we will always use evidence-based practices. Thank you.
Okay, so thank you so much, Dr. Nida. As aforementioned, before wrapping up the session, we will go ahead and take some questions from the audiences. And Nida, you can also turn on your video now.
Yes, sorry, actually due to PPT video wasn't opening, so let me open.
Okay. Okay, Nida, so my first question to you is that how many hours does a post-COVID patient need to sleep in order to recover from exhaustion?
Okay, so this is quite an interesting question. Like this is not necessary for a COVID-19 patient that they keep on sleeping every day. This is not necessary. We will work towards the fitness of the patient. And like we are on the post-COVID rehabilitation, we will work towards the fitness of the patient. Not like that we will be sleeping at home. We will work on improving the respiratory muscle. We will train our lungs. We will improve muscle joint integrity. We will improve mobility status. So this is an any important thing to target, that we should must target on sleeping hour. You should take normal sleep, which is important, but always target over the improvement in the respiratory muscles training.
Okay, thank you. So now the next question from the audience is that what are the contraindications of chest physiotherapy in acute setting when the patient is on NIV with higher FiO2 and PEEP?
Okay, so same will be as we always do in other physiotherapy techniques. For non-invasive technique, patient is having underlying pathology like malignancy, pulmonary embolism, ribs fracture, or anything like patient is hemodynamically very unstable. And if patient is having any TROP-I positive, creatinine kinase positive, or even most important in COVID-19 patient is D-dimer. D-dimer is always increased in the COVID-19 patients. So we will target over if D-dimer is very, very much increased, then we will also try to be a little gentle in our physiotherapy techniques. And similar contraindication will be like we use in our physiotherapy other pathologies, like if patient is having pulmonary embolism, pulmonary edema. In such techniques we will not perform physiotherapy non-invasive or in non-invasive.
Okay, Nida. So now I'll go ahead with the last question from the audience, and that is, why is there chance of blood clotting post-COVID?
Okay, so post-COVID, maybe due to any underlying pathology, they can have clot, and also what we can say is due to D-dimer. D-dimer is basically in patient. What we see is they are having any clot or thrombus in their body, because COVID-19 basically targeted heart too, na? So it basically leads to any coagulation deformities or diseases. So it basically leads to hemodynamically instability, and which leads to the increase in D-dimer, and ultimately when D-dimer is increased, very much increased, leads to clots in the blood. So this is the reason.
Okay, Nida. So thank you so much for this really insightful webinar and your insightful answers to these questions. We're really grateful to have you here with us. So it looks
Thank you
like
so
we
much,
have
Habiba.
Okay, so it looks like we have covered almost all of your inquiries. Since we're running out of time, if you're left with some more, then you can contact our speakers on their respective contact numbers and email addresses that you can see on your screens. So if you have any queries, you can just send in your queries to them. I'm sorry we cannot cover all of your questions. So now, ladies and gentlemen, put on your thinking caps because it is now time for our quiz session. So I will be presenting you with one question, and all you have to do is to click on the raise hand option for those of you on Zoom, and the first person will be selected to answer. If you answer the question correctly, we will be rewarding you with a certificate of honor. So let's get started. You can see the question on your screens as well. So here it goes. If a patient diagnosed with COVID-19 is on face mask and his arterial blood gases show respiratory acidosis, what should be the treatment plan of a physiotherapist?
Okay, so this is one of my favorite questions. I used to ask this to my students. So let's see who will answer this first. Okay, let me give you one hint for this. As we all know, what happens in respiratory acidosis? Can anybody know what happens in respiratory acidosis? In respiratory acidosis, pH is decreased and there is increase in carbon dioxide in blood. So what will we do if patient is with respiratory acidosis and COVID-19? So what will be our treatment plan? I don't have know why people are telling me the treatment. I want physiotherapy treatment. Okay, so we will
Okay,
pick the first one.
so basically, we got an answer from Natasha that is pH is decreased in this.
Okay, no, I want treatment plan. Like, what will be treatment plan of physiotherapist? Natasha is right. Good,
Okay,
Natasha.
so the next answer is from Nabila Khan, which is partial pressure of carbon dioxide increases.
Again, we want treatment plan. Like, what role physiotherapist? As a physiotherapist, you will play. Like, we know medically, you both are correct, but I want treatment plan of the physiotherapist.
Okay, so this is from Supriya Patel, that pursed lipped breathing.
Very good. First lip breathing is great technique which we can use, or if I elaborate this more, so our target will be towards the expiratory exercises like pulse lip breathing, tissue blowing exercises, and if we talk about the pediatric population, so we will target toward the play-based therapy of like blowing exercises and blowing games. So
Hi,
we
we
have
had
our winner.
someone raising their hands.
Yeah,
I would just,
actually.
I would ask that person to unmute their mics.
Okay, so we saw Kutsia raising her hand. So can you please turn on your mic, Kutsia, so that you could answer?
Yes.
Hello, Kutsia and
Same.
Tizar. We would like you to
Hello.
answer the question.
या सेम आंसर था मेरा कि जब भी जब कार्बन डाइऑक्साइड रिटेंशन होने लगती है बॉडी में तो हम पेशेंट्स को जो है एक्सप्लोरेटरी एक्सरसाइज करा रहे होते हैं मोस्टली लाइक टिश्यू ब्लोइंग और पल्स विद ब्रीथिंग वगैरह जिससे जो है कार्बन डाइऑक्साइड जो है वो बाहर जाती है.
Okay, very good, Kutsia. We are proud of you. You have given accurate answer. Very nice.
Thank you, ma'am.
She is one of my favorite students. She is such a hardworking girl.
Okay, Nida, so is this answer correct? Should we announce our winner?
Yes, you should announce winner. She is
Okay.
perfectly correct.
Okay, guys, so our winner is Kutsia Intizar because she raised her hand and then she answered the question correctly. So,
and I can see many people are also answering. They are absolutely correct. But we have to announce only one winner. So we will announce Kutsia, but you all will also get certificate of participation.
yes, you all will get a certificate of participation, and Kutsia, you will definitely get your certificate of honor as well. So guys, as Bruce Wilkinson once said, a moment of gratitude makes a difference in your attitude. It is with great pleasure that I now present the vote of thanks for this webinar's proceedings. Firstly, I'd like to thank our guest speakers, Dr. Samana Sayed and Dr. Nida Rizvi, who despite their busy schedules, graced us this evening with an incredibly enlightening presentation where we were extremely grateful to learn about COVID-19 rehabilitation. I would also like to extend heartfelt gratitude to the live study group's lead, Samantha Simbu, and by extension, all the leads for their major contribution in making this event possible. A special thank you to two of our core facilitators, Marina Huck and Arusa Elias, for their endless support. Last but not the least, ladies and gentlemen, I'd like to thank you all for accompanying us tonight and making our event a success. And we look forward to your continued support. And for those of you asking about having the recorded video, so you will get access to this video on YouTube after 2 weeks. Gentle reminder to fill out the feedback forms, which was sent to you in your invitations to your emails and also in the Zoom and YouTube chats a few minutes ago. Remember that those of you who fill this out will be getting certificates of participation. So make sure that you guys fill in the forms. Please note that certificates will be sent out within 2 weeks' time. Thank you so much, all of you, for.
And if you have any inquiry or any question, you can contact us.
Yes, you can definitely contact us. So finally, for those of you who are interested in joining SAC and by extension the LSG, please indicate by doing so in the respective section in the feedback form. Thank you and good night all.
Thank you so much.